Well, good afternoon, everyone. It's just about 3 o'clock, so we'll go ahead and get started. This is Jill with Arch. Welcome to our discussion today on respite during COVID-19. We are recording this to share with our colleagues who couldn't be on the call today, given that we did this with a rapid scheduling. I did allow everyone to enter unmuted so that we can have an interactive call. However, I would appreciate it, and this is the beauty of Zoom, you can mute and unmute yourselves when you're not speaking. In the left-hand corner of your screen, if you connected to audio via phone or computer, you should see a little phone or a microphone that you can click on and off to mute or unmute yourself. So I would just request that if you're not speaking, please keep yourself muted. We do have quite a few people on the phone, but I think because we really want to encourage discussion and to know who we're talking to, let's just quickly, if each of you could introduce yourselves. There's also quite a few people with just a phone number and no name. Just quickly unmute yourself and introduce yourself. That would be very helpful.
Veronica.
Please go ahead.
Director of DEEP.
I'm sorry, I missed that. Who was that?
Veronica Diaforli from the Family Resource Network.
Okay, great.
Brooke Bartholomew from DEEP.
Tina Urich from the Illinois Respite Coalition.
Elisa
Catherine,
Dickerson.
Megan, and Amy from the Colorado Respite Coalition.
Elisa Dickerson from the Rhode Island Office of Healthy Aging.
Peggy Spalding, Colorado State Unit on Aging.
Kristen Smith, Nebraska Respite Network.
Miriam Adepour, Family Caregiver Alliance of Rhode Island.
Val Madsen, Respite Association of Wisconsin.
Christine Santi, Easter Seals, Delaware.
Jill McCormick from Lifespan Respite of Washington.
Corey Lutz with Helping Hands of Vegas Valley and Nevada Lifespan Respite Care Coalition.
Greg Link at ACL.
Jim Holman, Lutheran Social Services, North Dakota.
Leanne Winchester, Massachusetts.
Connie Siskowski, Florida Respite Alliance.
Utah Ulrich, Arizona Caregiver Coalition.
Good afternoon, Robin Boswell, Lifespan Respite Oklahoma.
Nadine Walter, Lifespan Respite Oklahoma.
Cheryl Donnell, Nevada Lifespan Respite, Respite RX.
Dana Allard Webb, Aging and Long-Term Support Administration, Washington.
Nina Press, New York State Office for Aging.
Katie Allen, Finger Lakes Caregiver Institute at Lifespan of Greater Rochester, Rochester, New York.
Lisa Schneider with the Respite Care Association of Wisconsin.
Rachel Hatton with the South Carolina Respite Coalition.
Ann Mangelsdorf with the St. Louis ARC in St. Louis, Missouri.
Hi, everyone. Dorinda Adams with the State of Maryland Department of Human Services.
Naomi Duffert, State of Maryland Department of Human Services.
Anyone else with us? There are
Mary
I'm sorry, go ahead.
Resource
Sorry.
Network, New Jersey.
Sarah Cage, Idaho.
Mary Sherrill, Mississippi, Lifespan Respite.
Sarah Taves, Idaho Caregiver Alliance.
Gene Sherman, Florida Lifespan Respite Alliance.
Anyone else? Several folks have written their information into the chat box as well. We have Ben Stromberg with the Nebraska State Unit on Aging, Ellen Bennett with the Nebraska Lifespan Respite Network and Nebraska Caregiver Coalition, Maria Hernandez with the Texas Health and Human Services Commission, Gina Boras, and I apologize if I'm mispronouncing your name, with the Texas Health and Human Services Commission, Patrick Kelly from Montana, Autumn Blattman with the Nevada Aging and Disability Services, and I think the other people mentioned themselves, Nick Slentz with the Virginia Department for Aging and Rehabilitative Services. So thank you everyone very much for joining us. I did just quickly want to mention, because it just came to my attention, for those of you who are current or former state lifespan respite grantees, the funding opportunity announcement for the Lifespan Respite Care Program state program enhancement grants was just posted yesterday. So I wanted that to, on grants.gov, so I wanted to bring that to your attention. The FOA for new state grants was posted last week, and the deadline is approximately or exactly 60 days from the date of being posted. So after this call, you might want to jump to grants.gov and get the information about the FOA. I'm really heartened to see so many of you on the call today. I know that we find ourselves right now in the most challenging of times when we're being told that, you know, along with hand washing, one of the most important things we can do to prevent the rapid spread of this virus is social distancing. I personally prefer the term physical distancing, because I think the last thing we want to do is encourage our family caregivers to be more socially isolated at a time when support from family and friends, community, and even us in the Respite Network is so vitally important. So I hope today that by sharing our creative efforts, we will come away with some great ideas to help family caregivers, either virtually, on the phone, or maybe even through some other means yet untapped on how to stay connected and how to get some respite for themselves, even if it's not from the traditional formal respite service system. One of the things that prompted this call today is that I've been receiving calls from some of you who are very eager to know how other state grantees and partners are interacting with the families and caregivers they serve, either through their voucher programs, through in-home respite supports, and helping to find providers, advising families on whether it's safe to bring providers into the home, or just other ways to get that very important break. As I mentioned in the email, we really don't have any formal presentations prepared for this call. We're just hoping that this conference call would provide a welcome opportunity to help you all share any information you have with each other quickly, and have an opportunity to ask your most pressing questions of your colleagues, and above all, to get great ideas from each other. I did pull together just a few slides to share with you the resources that I'm aware of. I started compiling these that came to my attention through my inbox, or some of you were gracious enough to share them with Arch, or just others that are circulating very widely among all the national and state disability and aging organizations. I tried to comb through all of these and pull out the ones that I thought were the most salient and important for supporting family caregivers. And this first list are resources from the primary national caregiving groups. And most of you have probably seen all of these, but I thought compiling them in one place might be helpful to you. Something that just entered my inbox was a survey that the Elizabeth Dole Foundation did military families, and one of the top findings was just ways to keep themselves and their families entertained at home. So that's certainly a type of respite that we all would benefit from. And I think they're going to be posting some resources through their Hidden Heroes webpage to help families get that very important break from their daily routines. And again, all of these resources that I'm going to be sharing with you on the next couple of slides are all posted on the Arch website now at that link in the last bullet. I also pulled together just a few of the many government resources that are now widely available. Again, I've tried to pull some that I thought were the most related to caregiving and getting the break, or on dealing with home care workers in the home. And also, I wanted to point out that Veterans Affairs has a resource called Building Better Caregivers Online course. And that course does assist family caregivers in dealing with stress and anxiety, and it's something that can be done from their own home. So I thought I would point that out. And also to know that the VA Caregiver Support Line has trained social workers. If you're calling about, if someone is a family caregiver of a veteran, the social workers are there to help, but also even just to listen if family caregivers need to vent a little bit. So that's a great resource. Some of the national aging and disability organizations, again, you may be familiar with these. One I wanted to point out is the AARP is holding every week on Thursdays at 1 o'clock Eastern teletown halls on the coronavirus and how it affects family caregivers and how to keep family caregivers and the people they're caring for safe. The ARC, the Autism Society Family Voices, also have very important resources that are important to the populations that they serve, and I thought would be useful for you to know about. And then finally, just a few of the resources that some of you have graciously shared with me. The Colorado Respite Coalition has a magnificent spreadsheet of resources that they're continuously updating that you can access right from the main page of their website. The Respite Care Association is doing a webinar series all this week, every afternoon at 1 p.m. Central Time on resources around caregiving and the pandemic. And they've graciously invited the Lifespan Respite Network to participate in those. And we're going to be hearing from Lisa Schneider with the Respite Care Association in a few minutes, so she'll tell you a little bit more about that. And then I pulled some new resources that were just posted on the Virginia Navigator. That's the state's statewide aging and disability resource website that provides some really wonderful information. The Virginia Navigator was a primary partner in one of the first Virginia Lifespan Respite grants. And these are some of the resources that I thought you might be interested in. They have many more resources as well too on that site. And then finally, I wanted to remind you of a document that ARTS just produced recently in conjunction with our Life Course Respite tools, because it brings together lots of alternative ways of finding respite outside of the formal respite service system. In this document called Exploring Respite Opportunities and Options. And I thought it might be helpful to you as you're working with family caregivers. I mean, many of the resources are out in the community, but there are also many others. Like just on this first page, there are some that link to caregiver blogs and podcasts, to online caregiver support groups. There are links to virtual museum tours, or mindfulness, stress reduction, and anxiety reducing apps. So I encourage you to go back and take a look at this list. And also, if you discover new options that families can use at home to get a break, and we're very happy to add it to this list and to the Arch website for resources. Does anybody have any questions about any of these resources?
No, I'm just glad that the website.
I'm sorry?
I'm just glad
Jill, this is
on the website.
Sorry, there was somebody talking at the same time. Something about the website?
I'm just glad they're going to be up on the website.
Oh, okay. Sorry about that. I think my hearing is going too.
And this
Yeah.
is Greg at ACL. Hey, Jill, is there any? Can I maybe talk to you after this about possibly how ACL could link to all of these resources that you have? Because we have our own COVID-19 information page, and we're building out a section for family caregiving, and this is just awesome what you've collected here.
Oh, great. Yeah, I think on the government resources page, I listed your page right up here at on the top of the government resources, so that you're more than welcome as always to link. And again, I posted all of these on the Arch website at this link at the bottom of the last bullet on this page.
Okay, so I'll make sure that we then link to that, because then that would be all right. Great. I'll take care of that after this call is over.
I'll send these around too with the recording of today's call, so everybody will have that in hand.
Sounds great.
Any other questions? Lisa Schneider, as I said, with the Respite Care Association of Wisconsin, very graciously offered to kick off our conversation today by sharing what they're doing in Wisconsin to support the state's family caregivers around the pandemic. And Lisa, I did hear you on the call. Are you still available to give us a quick update on what you all are doing?
Absolutely, and I may have Val chime in a little bit because she has really expanded some of the things that we're offering. So basically what we're doing is every day this week from 1 till 2 Central Standard Time that we're offering information, trying to keep it to 30 minutes so it's short and sweet, because we know that we're all having back-to-back conference calls if you guys are anything like my schedule lately. So I know we are putting out information in regards to our Respite Care Certification Program. And I'll have Val talk a little bit more about that at a very high level, because you guys are all able to join in on the daily webinars that we're holding that kind of goes over all of the services that were offered. But what's been really nice is that just by a few couple connections, our stuff is getting blasted all over the state. So there's some geographical service regions that are all of their family care, IRS, children's long-term care support waiver folks are all jumping in on our webinars to learn the resources that we have to offer, along with wanting to try to connect those who have been temporarily laid off or unemployed via, let's say, adult day services closing, and connecting them to our registry. So they may already be, we're going to either find out if they're trained or not and eliminate that requirement so that they can be listed on our registry. So more people who are in need of somebody to come on in their home and provide respite, like me right now with my child playing on her Facebook right now, so it's kind of going crazy out there. But so to try to serve as that vehicle to connect the two ends together. And Val, I'm just going to let Val speak a little bit more about what she's offering, because her COVID-19 packet and her Respite Care Certification Program things are two really big hot items right now. Val, are you there?
I am, thank you. Yeah, so we created a Respite Care Certificate Program many years ago, and it's a series of 9 different courses that people, kind of a Respite 101, and those are free at any point in time, and that's typically what we offer or ask people to take in order to get on our registry. But this last weekend, what we put together was really finding your new normal in the COVID-19 pandemic that we're in now. And it really talks about different topics such as how do you explain COVID-19 to someone who has a disability, whether it's a kid or an adult or elderly, different social stories around that. So lots of tools that you can take and use right away. Looking at special ed requirements, if your child's now out of school, what does that mean specifically for Wisconsin, and what legally do they have to give, along with looking at different activities that you can do to fill your day, how to set up a routine or a schedule to get you through your day. But then we added a new section in the last day that really looks at protecting in-home workers, direct service workers, whether it's respite, personal care, whatever, and how to keep them safe, how to make sure that you're using whatever resources you have. So it really is it's technically in our learning management system, but it's not a course. It's just a spot that we have lots of different resources for anyone to access. Some of the information is very specific to Wisconsin, but it is a public link that anyone would be able to go on and get the information. During our weekly webinars, again at 1 Central Time every day, I do kind of walk through to show the sections a little bit better. So feel free to join us in the next couple days. Lisa,
Wonderful,
anything
Val.
else you wanted me to say?
Nope, I think we covered it. If things continue to have such popular demand, we will probably continue to run these daily webinars next week as well.
And if you see on this slide, the second bullet is the link to the Respite Care's website. That'll take you to a lot of the information that Val was talking about. Any questions for Val or Lisa? Okay, who wants to go next? Who has a question or a resource they'd like to share?
This is Cheryl Donnell with Nevada Aging and Disability Services Division. I don't know if any of the programs are finding a big impact on their services or a minimal impact on their caregivers in this environment. But I've certainly noticed a difference in the caregivers who have hired their own workers and have negotiated with their own workers a comfort level regarding how to proceed or whether to suspend services. And I know that we have some of our respite providers who land under essential services and others that do not. And I wondered what other states were experiencing in the array of caregivers that they might be supporting.
So this is Veronica from the Family Resource Network. I oversee our respite services statewide. At the moment, our one-to-one respite workers are considered essential, and we're continuing to promote that. Here in New Jersey, our governor has said that we can help to replace some of those hours even with lost day program and try to provide additional respite hours wherever possible. So we're just trying to do whatever we can to meet the needs of every family who's continuing to work with us and any families that may reach out. But we are operating as if our in-home respite workers are all essential at this point.
Are any of you being asked, especially those of you that are doing respite voucher programs or normally send providers into the home, are you being asked by caregivers to recommend whether this is a safe practice or not?
This is Veronica again. We actually are going by what I guess I'll call the health protocols. So we're calling before going. We're asking very specific questions before deciding whether it's a good idea to go in or not, reschedule, or just put the service on hold, case by case.
Veronica, this is Lisa Schneider in Wisconsin. First, I'm hearing a lot of families in Wisconsin that were receiving some in-home supports have turned them all off for a while now because I just think out of fear and maybe some misinformation. Does anybody have a tool that they're using to better inform secure receivers, that it's okay to still continue to receive some cares, that the people coming into their homes are aware of all the protocols? And then also, are you providing any PPEs for them?
A great question, because the PPE thing just came up for us. Listen, we provide a lot of our supports for families in the community doing respite. So under different circumstances, if we were doing like a facility base, we would be providing those. But when they're in the home, we're really asking families to let us know if they have any need. We're certainly looking to any of our existing programs to see what we have, but we're really lacking in that area. So what we've offered is to any of our staff that may have their own supply, that at a reasonable expense, we would reimburse them to use their PPE supplies. The other thing too is that we're really just encouraging them to do that phone call ahead of time, which to make sure that it's a safe situation at best to go into. Your other question though, what was the first question you had asked? I'm sorry. Oh, about whether, like how we're letting families know, like it's okay to continue the services, you know, under safe guidelines. We've been trying to just communicate on the regular that we understand that this is an essential service, that we want to do it under the safest provisions, and that we're happy to do that and available to do that, and trying to communicate that regularly and hope that the message will be clear and they'll take advantage, even if not right now, when maybe in the upcoming weeks, they might see more of a need, but that's all we're trying to do is just highlight and communicate.
Thank you.
For those of you who have provider registries and link providers to families, do you have any fears about liability around continuing to allow the respite providers to go into homes? Has that a liability issue come up, or you feel as though you're protected as though you're always protected?
Hey, knock it off. You stop that barking. You hear me?
I don't want to hog the call, but I'm sure this is again from the Family Resource Network. Definitely liability is an issue. What we're trying, at least we're aware of it, that we know that we're at risk for that, but we are just trying to monitor what families, what staff may have been exposed, who are being affected. We're actually monitoring that day to day. I imagine if our numbers were to get, not that it matters whether it's 2 people or 100 people, but I would imagine at some point we would need to really discuss it if we found that our numbers were astronomical. At this moment, they are not, thank God, but we don't know what's ahead.
Anyone else want to address that particular issue, or do you have another question or comment?
This is Ann Mangelsdorf in St. Louis, and we do keep a listing and some tools and resources that families can use, but the listing is pretty loose. We pretty much have a disclaimer: the people that are on the listing are not our employees, and we give families tools to do screenings and things of that nature, but right now we do not feel a sense of liability.
It would be the same for Wisconsin as well.
Has anyone suspended your voucher program or any other respite services where there are direct contacts in the home? I'm assuming most of you have closed community-based programs. Is that correct?
Yes.
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 What about the voucher programs? Have any of you suspended your voucher programs temporarily?
No.
This is Megan in Colorado. We haven't, but I mean, it's very much, I think, similar to other places, case by case, with kind of leaving it up to providers and families directly. But I would definitely say we're seeing an uptick in families saying they're uncomfortable with any type of service. So I think we're primarily getting questions about how far out we can extend vouchers for people, which, you know, we obviously don't really know the extent of the timeline for this right now.
Right.
That seems to be the same in Wisconsin with our caregiver respite grant program. We're getting more calls saying, can I have longer than the normal allotted time to use these grant funds, because people are wary of having visitors in their home.
So this is
same
Jill from
goes-
Washington State, and we're kind of in that same realm. Our essential list that the governor put out does include respite caregivers, but families and some of our respite providers are doing their own quarantining and sheltering in place, and so that the extension is the question that has come to us predominantly, and Dana can probably address the how we're looking at extending those and giving exception to those time limits.
Hi, this is Dana Allard-Webb in Washington as well. And yes, we're planning on asking for a no-cost extension because Washington, of course, is the first in the nation to be hit. And so we're a little bit ahead. We have put out new management bulletins for home care agencies and individual providers. And in Washington, we must use those types of providers because of laws that we have. So we kind of are leaving it up to home care agencies to triage and decide whether they want to send their caregivers into homes that may have COVID-19. Especially if they're, go ahead.
No, you go ahead.
Well, especially if they're, if it's just respite, they're triaging because we have a lack of caregivers already, and because, like Jill said, they are self-isolating or taking care of their own COVID-19 relatives at home, etc. So the home care agencies will be triaging, and I imagine respite will be put on the back burner for most of them, because as the people who crucially need care, like people with paraplegia, for instance, we're going to be stretching pretty tightly our caregivers.
This is Lisa in Wisconsin again. One big thing that came up yesterday, and it ran rampant, are any of you being asked to have your respite workers have an essential critical designation letter? Does that ring a bell to anybody?
It doesn't. Can you expand on that a little?
Sure. It's a letter that basically, and I don't know who they're anticipating would ask this, but I'm told that they did this with truck drivers now, that they have a letter that indicates to whomever asks that they are part of, listed as critical essential services, who they work with, and the type of services that they provide. And I know several agencies here in Wisconsin have provided that to all of their staff via their last payroll. So they have a letter that they carry with them. I can share that letter with Jill to share with other people if they're interested in such a thing. I just didn't know if any of you have heard of this being a requirement.
Yes, definitely.
Yes, our state is doing something similar to that, determining essential employees.
Same in Missouri.
Is there another comment or question on this line of discussion?
This is Cheryl from Nevada Aging and Disability Services Division. What are other states doing to kind of document the impact of this COVID-19 interruption or pandemic experience? Is there anything that they're doing to capture that in their data for future planning or addressing kind of some of the needs, or how to better adjust for like the extensions on vouchers, etc.?
Yes, this is Ann Mangelsdorf in St. Louis, Missouri, and we are doing just that, what you just described. We, I just lost my train of thought, I'm sorry.
Is that all the time? Don't worry.
Collecting data on the
Yes,
impact of the
thank you.
pandemic.
So we do have a database, and when people either are unable to use their hours, or they need additional hours, or they're having difficulty finding caregivers, or contact us about anything that would be related to the COVID-19 virus, then we are documenting that as we just put in COVID-19, and then we make a note about what the call was about. So we're hopeful that that information will help us when we're trying to sort through this at the end.
That was such an excellent question, Cheryl. I'm curious, anybody else collecting this data?
This is Corey with Helping Hands and also in Nevada. We are collecting it every time somebody calls and says they need a postponement on a voucher, or they don't want to use it now, or things like that. We are putting it into just right now an Excel spreadsheet just so we can keep track of it since we're a state funded grant.
This is Veronica in New Jersey. We just had our electronic health record updated where we're able to put in now like a cancellation note and the purpose. It's going to give us an opportunity to track those cancellations, why they're canceled, and then, yeah, we plan to use that also for data moving forward.
I would suspect that this would be vitally important information, not only for future planning for you, but for your funders. Those of you who are going to need to not only extend the vouchers out, but get permission from your state or federal agencies to be able to do that. Anybody else collecting the data?
This is Jill from Washington State, and with our Salesforce and how we've built kind of that piece on the back end, it collects any and all the data that's related to both the recipient and the respite care provider organizations. And so I think for us, it's filtering it creating that filter that's specific to COVID-19. And on the back end, we can do that pretty quickly.
Any further comments or questions on this topic? I'd like to change direction just a little bit then and ask, especially for those family caregivers now who are that you're serving with direct services, either through vouchers or some other means, and who are either not able to use the respite because they're in community-based settings or are uncomfortable having someone come into their home. Are you offering them any alternative strategies to get some respite? And if so, what are they?
This is Ann in St. Louis. One of the things we are doing is considering, we haven't made a decision about this yet, but probably by tomorrow, whether or not family members living in the home, which is one of our policies, that family members living in the home cannot provide that care. But we are rethinking that for people who have extended family in their home and might want to use them. We're also looking at things like, for folks, we haven't been allowing them to use it for work, but we are looking at that as well. So just kind of revisiting some of our policies for this period.
Very
This is
interesting.
Megan in Colorado. We're
Go ahead,
kind of
sorry.
doing something similar with, we're focusing it on our state funding right now. We do respite grants through that, so not federal and not vouchers for the moment, but looking at, can we kind of similarly, I guess, changing policies of sort of what our definition of respite for this time period is. So looking at, we've got groups that are considering, you know, instead of doing center-based care, can they do kind of virtual, you know, one-on-one or two-on-one meetings with people to still be doing some sort of interactive activities. Obviously they can't, you know, may not be able to go into the home and do that. And so we're kind of looking at, you know, can we shift the way that we reimburse and define respite to at least give people a break, even if they're one room over.
This is Sarah from Idaho. I want to applaud Anne, the decisions or thinking that you're doing about, you know, what qualifies as respite and who can provide it. Idaho has been running a pilot of consumer-directed respite, and it has just been so positively received, particularly in rural communities where finding providers is really difficult. So now families are able to, you know, hire a neighbor or a granddaughter or grandson. It's just, I think that's great that you're looking at, you know, how are we putting the parameters around what respite is and how we can support families in developing their own models. Along with that question though, earlier in the call, it was mentioned that Wisconsin has their respite caregiver training. I'm assuming that's available to anyone that through the web. Would we be able to send potential respite providers to your site to do that training?
Yeah, so this is Val from Wisconsin. You definitely can. There is some things that are specific for our state though. So I would suggest kind of going through it, but the general information is just a really great way for the information to get out there. So yeah, it is definitely open to other states. It's just a matter of like some of the statutes that we go through are Wisconsin specific.
Anyone else using some innovative, creative strategies to get support to family caregivers so they can have a break? I was hoping to hear lots of great ideas from all of you.
This is Megan again in Colorado. If I don't know how many states and how many grantees do the stress busting program, but if you do that and aren't aware, they just released a virtual version of that. So you can connect with WellMed and Jennifer Kretschmar. I'm happy to point people in that direction if they're interested in learning more. So we were actually in the middle of one of our 9-week classes and have switched that to virtual. And we're also looking at partnering with a couple groups to do like a virtual caregiving support group in the next few weeks.
Great, great ideas.
Jill, this is Pam in Idaho. Powerful Tools for Caregivers has just put out a online option as well.
Are these appearing online now because of the pandemic, or were these in the planning stages anyway?
I think it was in the works, but they may be releasing it now because of the pandemic.
Right. That's really good to know.
Yeah, we had a site in Idaho that was part of a test last year, and some other states probably participated. But we were just looking for methods to make things more accessible in a non-face-to-face way, and voila, PTC put it out. So we're looking at, yep.
That's wonderful to know. Thank you for sharing that.
Yeah. Sure.
We're the first to know.
Jill, this is Massachusetts. Can you just tell me, yeah, where can you get that resource again for the Powerful Tools for Caregivers?
Just the Powerful Tools for Caregivers, Google it. They just sent out a notice to all class leaders. Sometimes host agencies don't get the information, but anybody who's a certified class leader probably got an email. So I think you can just go to the Powerful Tools for Caregivers. I don't know if it's .org, but if you Google it, it'll take you to the headquarters.
Thank you.
You bet.
And these programs like Powerful Tools and the Stress Busting program, which is, it's the WellMed Charitable Foundation. Is that correct, Megan?
Yes.
Everybody correct me if I'm wrong too, but these are also proprietary tools, so they're going to cost you some money. Not that that's a bad thing, but just for purposes of transparency.
Great, thank you.
Any
Hi,
other
Jill.
resources? Go ahead.
Sorry, it's Dina Press from New York. I just wanted to share, we did receive an update from our Director Greg Olson this morning that he's worked with the Association for our Area Agencies on Aging in securing some additional robotic pets to help combat isolation. So it looks like we're going to be getting another 1,100 robotic pets to be able to disseminate starting next week. So that's been a pretty successful program that we've launched last year or a year and a half ago. And so was happy to see that report today that they're going to be looking at getting more of them out.
Well, that's really interesting. Can you talk one more second about that? Is that an expensive investment, the robotic pets?
No, not at all. And actually, they did provide a discount, for our area agencies on aging that were interested in making the investments. They piloted first to see, and they tracked, the success and had really positive results. So I can share through the chat feature if you'd like, the website where you could learn more about it. But
that would be great if you could do that.
Yeah, I'd be happy to. And then another idea that I just had, but I don't know if others have thought of it or using it, but I was just thinking about, the Headspace app with maybe offering some guided meditation.
Yeah, absolutely. I think we list some of those apps in our resource as well, either mindfulness apps or stress reducing apps. There are quite a few of them out there, I think, that can be helpful to people. I'm just wondering how many of you are getting a lot of calls from caregivers for things they can do at home. Are you hearing from them that this is something they want and need?
So this is Jill from Washington State again, and ours is mostly kind of with those younger families kind of end because kids are home and because of now how our state is. And so one of the things we've looked at is how to create virtual play dates, how to create online space for friends to get together and do online tabletop gaming, social games, mystery theater kinds of things, creating space where kids can work together to create things that give some space for families. They can kind of keep track of how things are going, but don't have to be constantly the one providing that support for their kiddos and keeping them engaged when they can work together as friends to do things for short periods of time using Facebook Live, the free Zoom platform, some of the streaming platforms that older tabletop gamers have been using for a while. Now younger kiddos can create space on those for themselves. So that's some of the things we're putting out there for families.
Would you mind entering, if you have any of those links, into the chat box, or Another alternative is that I plan to do this afternoon that I promised to do yesterday was send around one of our Lifespan Respite Exchange emails and ask people to put all of these wonderful creative ideas, either send them to me or enter them in the Lifespan Grantee discussion forum, and we'll try to add them to our list of alternative respite options or add them to our COVID-19 resource page. So
Sure.
that would be great.
Yeah, I will do that one because I don't think there's a lot of them. So I'll just compact it all and put it in that email.
That would be wonderful.
Also, this is Lisa in Wisconsin. Rachel shared with me. It's called Air Console. So I'll put the link on there, airconsole.com, but it's something where she was playing games with 9 of her friends last night. They were playing adult card games, but there's all kinds of games where kids can be interactive with people in different locations. Some are educational, some are fun. It's not the shoot 'em up kind of games. Some of them are as basic as, like Monopoly and stuff like that. It looks really fun.
Yeah, these are great. And, things like webcams at zoos or virtual museum tours can be useful to keep our loved ones occupied and give caregivers a break as well. Having your book group meet online instead of in person. Anything that maybe caregivers were doing for respite before that we can suggest to them ways to move those things online. Are anybody doing anything along those lines? Or being asked by caregivers to provide some of those types of platforms or help? Do you feel like any of you are getting increased calls from caregivers just to talk about their concerns and fears? You're having to do a lot more online support.
This is Rachel from Wisconsin. Val, I just wanted to ask, so a lot of the resources that were just named, how many of these are already linked in one spot already in your Finding Your New Normal? Are a lot of these already in there?
Yeah, we have quite a few of them already linked. I'm taking notes and adding some more to that Finding the New Normal. So again, I try to put everything in one spot, but there's like 3 sections of different activities, including like the virtual field trips and art classes and all of those things kind of all in that one spot. So I think that's a good start for anyone who is interested in taking a peek at it.
Awesome. That's really great to knock down those silos and make one centralized spot for everyone.
And you're going to send us that link with all of that centralized?
It's on our website. It's currently on our website right now on the homepage, and I will share it in the chat.
Great. Thank you.
Uh-huh. No problem.
Does anyone else have any other questions for your colleagues while you have them on the phone? We only have a few more minutes. Be sure to take a look at that chat box before you all hang up.
This is Cheryl from Nevada again. I know that we haven't had any calls, but we are making contacts with our respite program participants to see whether or not they are experiencing some impact so that we can at least flag those ones that may need to be revisited for extensions or for some sort of an alternative or some additional assistance that they might be looking for food or supplies or things like that. So we aren't getting calls. I don't know if that's the experience of everyone, but I haven't really received any calls. We're making the contacts just to check on people, and they really appreciate it. They actually have been grateful for the calls to check on them and see how they're doing.
That's great to know. Anyone else doing those kinds of proactive calls, reaching out to all of the family caregivers on your email lists or in your voucher program and letting them know what kinds of things you have? Yeah? Who is that?
Easter Seals is doing that in Delaware.
Delaware, okay.
New Jersey too.
St. Louis ARC is doing that in St. Louis.
So you're not necessarily getting a lot of calls from caregivers. You're reaching out and letting them know what resources are available.
Yeah.
Yes, and we're doing
Correct.
a couple of ways. One is they may call about something unrelated. Maybe it's just related to something like their paperwork or something like that. But in the process of doing that, we make an extra point of asking them how they're doing. And they'll typically share, we don't have enough food, or I'm very frustrated with my child and I don't know what to do with them during the day, or things like that. So if you just ask a couple more questions as part of a routine, that gets at a lot of things. And then we've been compiling resources, but they're mostly local.
Right. That's very helpful. Any other? Well, maybe one last question that you might have for people on the call, or one more thing you want to share about your own efforts?
Well, this is Lisa in Wisconsin, not my efforts, but your efforts, Jill. I think I'm looking at this has gone from 65 people to 57 people. I'm wondering if this is something that, with the things changing so quickly, I'm wondering if you could, are interested in pulling this together again, maybe in another week or so?
Are people interested in that? We could certainly do that. It's easy to do.
Yeah, that'd be great.
Yes.
Yeah, I'd like that.
Okay.
Definitely. Yes.
Same time next Wednesday? We can
Yes.
put it-
Sure.
Yeah, very helpful.
Okay, let's do it again next Wednesday, and then we'll reassess if there's an ongoing need. We'll keep it going.
Cool.
Sounds
And
great.
again, all the
Sounds good.
resources that you've shared in the chat box or you sent me via email, I'm going to add them onto the Arch website as well. So it'll all be in one place. But I'm also going to send around that Lifespan Respite Exchange. So if you think of some great ideas for how to get respite virtually on the phone or otherwise, or ways that people can feel more comfortable about respite providers coming into their home, if that's something you're comfortable with, just send that all to me and we'll try to keep it in a central location. And it'll be, focused on respite, because I think that's what we can contribute to the field. So I'm very grateful to all of you for being so willing to share today and letting us know what's going on with your programs and how you're dealing with issues and how you're reaching out to caregivers. You're all to be amazingly commended for the great work that you do on the front lines. So thank you, everyone. I will send around the recording and an updated list of resources, and we'll talk again next Wednesday at 3 p.m. Eastern.
Thank you.
Thank you all so much. It's great. Thank you.
Thank you.
Thank you.
Good.